Hello, my name is Kara Rickford Grimes, and today I'm presenting on community glaucoma screenings using a novel glaucoma risk calculator to address access to care. I worked on this project under the supervision and mentorship of Dr. Daniel Laroche. I have no financial disclosures. The purpose of this presentation is to evaluate a novel risk calculator to detect glaucoma and to go through the methods used in screening patients in high-risk communities, as well as the results from our data analysis and our next steps. Glaucoma is a leading cause of blindness in the elderly and in Black and Afro-Latinx communities. Many screening methods require a comprehensive ophthalmic evaluation. We tested a novel low-cost glaucoma calculator to predict glaucoma risk and inform follow-up care in high-risk New York populations using only 3 variables: age, intraocular pressure, and central corneal thickness. This is the glaucoma calculator created by Dr. Laroche. Next to the space for IOP, CCT, and age, there are columns to include corresponding numerical values. These values are then translated to points that will determine the patient's glaucoma risk as either low or high. These points were assigned based on preliminary findings from our original retrospective study published in the Journal of Ophthalmology. Shown here are each of the 3 risk factors, as well as their corresponding numerical values from -3 to +6. For example, if we had a 64-year-old patient, they would be assigned a numerical value for age of +3. This is exactly what we see here in this sample patient. If we take a look at the points assigned to the patient's right eye of 1, 1, and 3, these total 5, which tell us that the patient's right eye is low risk, as opposed to their left eye, which is 6 and considered high risk. Those with a low risk categorization were recommended for a reevaluation in 1 year, and those with a high risk were recommended for complete ophthalmic evaluation as soon as possible. For the purpose of this study, all participants were offered a free comprehensive eye exam to determine whether the calculator was accurate in predicting glaucoma risk. Our study was a prospective, observational, community-based participatory study, and our examiners consisted of non-physician personnel made up by trained medical students and technicians under physician supervision. Our screenings were located throughout urban New York City communities at high risk for glaucoma. Participants were recruited through community fairs, churches, and flyers distributed in person and on social media. There were a total of 601 participants that were screened and provided consent, of which all that were under the age of 40 were excluded. This left 525 participants that were eligible for this study and completed the glaucoma screening. 122 did not follow up for a comprehensive eye examination, so our data is based off of the findings from the 403 participants that completed this study in its entirety. Of these 403 participants, 132 were considered high risk and 272 were considered low risk, based on the risk assessment by the Laroche calculator. When these participants followed up for a comprehensive eye exam, 76 were diagnosed with glaucoma, 36 were considered glaucoma suspects, and 291 did not have a glaucoma diagnosis. For this study, those with a diagnosis of glaucoma and those determined to be glaucoma suspects were categorized as one group. This allowed us to calculate sensitivity, specificity, and our positive and negative predictive values. As you can see here, the sensitivity was 92.9% and the specificity was 90.7%. This also gave us a positive predictive value of 79.4% and a negative predictive value of 97.1%. The predictive values help determine the diagnostic value of this test. Our results also showed findings that correlate to current published literature, including that those considered to be high risk for glaucoma had an increased intraocular pressure compared to those that were low risk and had a decreased central corneal thickness compared to those that were low risk. In summary, this glaucoma calculator had strong data that revealed high sensitivity, specificity, positive, and negative predictive values. The tools used in this study, including handheld tonometers and pachymeters, are less expensive than those used for traditional screening purposes. In addition, based on the findings of this study, those that screen positive using this risk calculator can be referred for additional testing and physician confirmation for glaucoma. Further research in different populations is recommended. Once again, my name is Kara Rickford Grimes, and thank you for attending this presentation.